Polycystic ovarian syndrome is the condition when women with polycystic ovaries also have one or more additional symptoms such as irregular periods or hirsutism or weight gain and so on. Polycystic ovaries is when there are no symptoms, simply the appearance of cysts under the ovarian surface as seen on the ultrasound scan. In 1935, Stein and Leventhal first described the association of cysts in the ovaries and a combination of obesity, masculinizing symptoms, and infrequent heavy periods. For many years, this was called the Stein-Leventhal syndrome. After the invention of hormones and their studies, and subsequently ultrasound scans, we could understand the condition better, and it's now called PCOS, or polycystic ovarian syndrome. The term polycystic ovaries describes ovaries which contain many small cysts, usually no larger than 8 millimeters each, located just below the surface of the ovaries. These cysts are follicles with eggs that have not developed properly, abnormal hormones and underdeveloped eggs. Which of them comes first is the classical egg and chick conundrum. In 20% of women, a pelvic ultrasound scan shows the appearance of PCO, but only half of them have symptoms, and this group is called PCOS. The associations for PCOS are as follows. It runs in families. It's one of the leading causes of infertility in women. 20 to 30% of all infertile couples, the woman will have this problem. If it's not properly managed, PCOS can cause other health problems like diabetes or high blood pressure and even cancer of the womb. And of course, PCOS can affect a woman's appearance and following to that, her self-esteem. PCOS is treatable, but it can't be cured. So the management of each case of PCOS will depend on her age and her personal circumstances. Symptoms of PCOS could be many. Some women have only mild symptoms, while others may have more severe symptoms. Some have few, and others have more symptoms. It's basically a wide spectrum. Symptoms can include irregular and infrequent periods, called oligomenorrhea, or a complete lack of periods, called amenorrhea. There could be infrequent ovulation or no ovulation at all. Fertility can be reduced, which means the woman finds it difficult to become pregnant, and there could also be recurrent miscarriages. Hirsutism is unwanted facial or body hair. Oily skin and acne is a common association of PCOS, and thinning of scalp hair or hair loss is also another common association. Weight problem is quite a common association of PCOS. Such women can have a high body mass index and may find it difficult to lose weight. Depression perhaps is a sequel to all of these problems related to weight and general appearance and hair loss and the hormones and hormonal changes. Infertility, obviously. Symptoms usually start in adolescence, though some women do not develop them until their early to mid-20s. We've already mentioned about the risk of developing diabetes and heart conditions. What causes PCOS? The symptoms of PCOS are due to changes in some of the hormones that control menstrual cycle, typically high levels of LH or luteinizing hormone and of androgens and estrogens. The most important androgen is testosterone, which is produced by all women. It's produced from the ovaries. Testosterone obviously is the more famous male hormone, but it's important in women as well, because most of it gets converted within the ovarian follicle to estrogen. Now that is the main female hormone. Testosterone is often thought as the male hormone, but that's just not the case. It's just that men produce 10 times more testosterone than women. Higher than average amounts of testosterone in women with PCOS causes many of the symptoms